A 48% reduction in cognitive decline just by using hearing aids? Really? Hi guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And in this video, I'm talking about the massive 48% reduction in cognitive decline that researchers identified during a study where they treated individuals with hearing aids. On July 17, 2023, an article was published in the Lancet journal by Dr. Frank Lin and others, revealing the results of the ACHIEVE study, which stands for the Aging and Cognitive Health Evaluation in Elders, that looked to identify if hearing treatment, i.e. hearing aids, had an impact on cognitive decline. Now, to provide you with a little bit of historical context here, Dr. Frank Lin from Johns Hopkins identified in a research article back in 2011 that there was an increased risk of cognitive decline and dementia for individuals with untreated hearing loss. In that particular study, he identified that individuals with a mild untreated hearing loss are 2 times more likely to develop dementia, individuals with a moderate level hearing loss were 3 times more likely, and individuals with a severe untreated hearing loss were 5 times more likely to experience dementia later in life. Now, there have also been numerous studies during that time that have linked hearing loss to dementia and cognitive decline. However, up until now, researchers have not been able to identify if treating hearing loss with hearing aids has a measurable improvement on the rate of cognitive decline and ultimately dementia. Now, bear with me as I review this research because it's very important to understand what they actually found during this particular study. This study was a randomized controlled trial to determine how hearing intervention affected brain health in older adults. They enrolled 977 participants from 4 different locations across the United States between the ages of 70 and 84 years old who had untreated hearing loss and normal cognitive function. To recruit these individuals, they took 238 participants from an existing heart health study and 739 healthy community volunteers. These individuals were then split between 2 different groups, a hearing intervention group and a successful aging health education control group that did not receive hearing treatment. These participants had semi-annual follow-up visits from 2018 to 2021 and underwent a final 3-year outcome evaluation to look at changes in cognitive decline, brain structure, mental health and well-being, physical function, and healthcare use. Now, I got a little discouraged when I got to the results section of this particular study because what the researchers ultimately identified is that there was no significant difference between the rate of memory loss and thinking decline in the hearing treatment group compared to the control group over the course of the 3 years. But they quickly turned my frown upside down because they also found out that when analyzing these groups separately, hearing intervention, i.e. prescription hearing aids, slowed down the loss of thinking and memory abilities by 48% over the course of 3 years in individuals at a higher risk of cognitive decline. Basically, the individuals who were already at a higher risk of cognitive decline saw a significant reduction in that decline with the use of hearing aids in that time period. This just confirms what everybody who's been paying attention to this research over the course of the past decade was expecting to see. Not only is treating your hearing loss with prescription hearing aids beneficial when it comes to improvement in communication and quality of life, but it can also significantly reduce your rate of cognitive decline if you are at a higher risk. So the question naturally becomes, are you at a higher risk for cognitive decline? Well, to help answer this question, I have attached some additional infographics for you to check out down in the description that you can look at to see if you have any of the other risk factors for dementia and cognitive decline. At the end of the day, I think the answer here is pretty clear. If you have hearing loss, you should be treating it, whether this is with hearing aids, surgical procedures, or cochlear implants and other implantable devices. Because as we now know, not treating your hearing loss is extremely risky, especially when it comes to your future brain health.